Dr. Tan Iping, consultant obstetrician and gynecologist. Okay, today I'm going to talk about a very interesting topic that not many people talk about. Partly it's because I realized that this is something nobody will talk about. They don't share, they don't ask, they feel shy to ask. So I want to create awareness because I know this group of women, they are actually out there, they really exist, and also they're suffering in silence. They suffer but they don't dare to tell anybody, so they keep in silence, they cry every night, they don't know what to do, they don't know who to look for, they don't even know that they're supposed to see a gynae and the gynae can solve their problem. So of course many of you may not be having this problem, but please share, because I won't be surprised some of your friends actually have this problem, but you do not know, I do not know. So you need to share the video to as many people as possible. So hopefully your friend who is suffering get to see this video and he knows where to go. Okay, so today I'm going to talk about one interesting topic, which is painful sex. Sex to us is not supposed to be painful, but to some women it is painful. And different women suffer differently. Some women the pain is moderate, some women the pain is very severe. Some women pain but they just can still have sex. Some women pain until they cannot have sex. So basically these women usually suffer in silence. Okay, so painful sex is a reality. It's a reality because I see in my clinic every now and then. And there is those people who know how to find me. Some of them don't even know how to come, or some of them even go to, I think among the Muslims, they actually go and see a certain body and they're talking about divorce, because there are some women who actually never had sex with their husband all their life. Okay, so I have seen women married 3 years, 5 years, and maximum I have seen 12 years married without having sex at all. Oh, that one I really respect the husband, because husband is still with her ma. But not every husband will stay so long with the wife without having any sexual intercourse. I have seen women who come to me and tell me that my husband say if I still cannot have intercourse, my husband is going to leave me. And there are people who are actually sent by the religious bodies to come and seek help sex, because if the husband and wife do not have sex at all after getting married, it's null and void, so the marriage is totally void, so you're considered not married at all. Don't even need a proper divorce. It's so easy just say we are not married at all because we never had intercourse, even though we signed the paper, even though we had our wedding ceremony. So a lot of women are actually suffering in pain silently. They don't share, they don't know who to ask, right? If you have painful sex, do you just go and ask your colleague, hey, my sex painful, how to do, what to do? They don't, nobody want to ask. Even going to see doctor also, I have some patients who come and tell me that their sex is very painful, and then they will tell me what, all this while I used to see a male gynae, I don't dare to tell him. You see, even when they see gynae, a lot of them also not dare to tell. They wait and look until they find a female gynae, only they dare to tell. So you see, what more, male gynae also they not there to tell. I'm quite sure even seeing female gynae, some also not there to tell. So what more if friends or even family member, you may not even ask your sister or your mother, so they are really suffering in silence. So I'm going to start on my talk now. Painful sex actually got two components. You have to see two things, okay? We can divide by many aspects. We can divide by pain level. As I mentioned earlier, you can have moderate pain or severe pain. You can have pain that you can still have sex but you just suffer, but you still do it. You just tahan and then you don't care. You just let it be lah, don't care. But you also can be so painful that you cannot even do it at all. Okay, so this is the one way to separate them, but based on the level of pain. Then there is another way of separating them. We separate them based on whether they had sex before. There are some people who have so much pain that they never had sex, and they never had sex. As I said earlier, some people can be married 5 years, 10 years, 20 years, but never had sex. But there are another group of women, last time actually no pain one, but now only got pain. Okay, so now only got pain, but is it now got pain, now can have sex or cannot have sex? So one we call is primary, one is secondary, okay? So the first group, last time, from the very first day they have sex, they have pain. Okay, maybe they still can have sex or they totally cannot have sex. But the sex started from the very first day they had sex, and it has always been painful. So that is one way to one group. The other group is secondary. Secondary means in secondary, pain means last time no pain, but now only pain. So last time they used to be able to have sex like normal, but now they have problem having sex. So because now painful, last time no pain, now only pain. So this is one more way you can divide the problem. And of course, we can have sex, painful sex, a different way. Another way to group it is who is having the pain, the wife or the husband. I mean, me being a gynae, majority I see women lah, but I still see one or two on and off is the husband having pain, not the wife. So then it's a different problem altogether. So you see, we can divide by the level of pain. Is it a pain that you can still endure and still have sex, or the pain that you cannot have sex at all? That's one way of dividing. The second way of dividing is the pain right from the first time you have sex until now, or is the pain last time no pain, now only pain? So that's the second way of dividing. Third way of dividing is it the man pain or the wife pain? Is it the man or the lady? So that's the third way of dividing. Fourth way is that there are so many ways of dividing. So the other way of dividing is these are the questions that I usually will ask the couples lah. So this is the fourth thing I want to know, which is where is the pain? Location of pain also different one. So is the pain down there? Down there. The moment the husband go in, she can feel the pain down there. Or is the pain at the tummy? At the tummy. So whenever have sex, going in still okay, the initial going in still okay, but once you go in, there's pain on the tummy. So that's where pain. So you see, so there is 4 things that we want to know whenever we have any couples who come to us with painful sex. Okay, so just now I have divided the 4 groups. Okay, let's start with male and female first. Of course, we want to know the pain is male or female, which is very simple. So I'm a gynae, I deal with female. That doesn't mean that I don't deal with male. I look at the problem first. Male, I will usually still send them to a urologist first to assess whether there's any physical problem. If there are no physical problem, I always say you come back to me, because if it's not physical problem, then you still need me to help you. Okay, so because a lot of urologists don't deal with sex. Sex is very often dealt with us gynae as well, because it's a way something that deals with women a lot more than men. Okay, so I will still send them to the urologist first. If the urologist said everything is normal, then I say you come back to me, because we have to deal with the non-physical causes. And then if it's women, okay, then I will ask the second question. I want to know, number 1, this pain is from the very first day you have sex all the way, or last time no pain at all, then now only pain. And what are the situations that can happen? I've heard so many stories. I've heard women who say, okay, there are some women, they have sex before they're pregnant, before they're married. So before they're married, they usually will use condom, they will take contraceptive pill, and those days they actually never had pain before. And then one day when they started getting married, or maybe not say get married, maybe you marry but you initially don't want baby, so you got use condom, you got take pill, and then one day you decided you want to have the baby, and then you stop using condom, you stop using pill, and that is when you started having pain. So a lot of women I've seen many women who ask me this question already. They say, is it because never use condom? Is it because condom no pain, without condom got pain? So they always think that maybe the condom is smoother, so not so painful. Now no condom, that's why pain. Actually, it's also not a reason lah. The reason is after that I will describe. So another group of people sometimes will tell me that before give birth no pain, after give birth only pain. So why after give birth only pain? Of course, it could still be due to childbirth, because initially after give birth, if you are breastfeeding, before your menses come back, you can have a lot of dryness. So if you have a lot of dryness, then of course you will have pain. But let's say if you after give birth, period already normal, then you're not supposed to have pain. If you have pain, that has nothing to do with the hormonal changes with pregnancy and breastfeeding. Okay, so I also see women, all these are women who after something happened, then only they started having pain. So all these causes is not necessarily physical. Let's say got one more reason I have seen. This lady, first baby, this lady I always like to quote, because the first pregnancy she gave birth is natural birth. After natural birth, she had sex, no problem. But second baby is a cesarean. So when she has a cesarean, and then after that, when she tries to have sex, she cannot have sex anymore. After the second baby Caesar, they cannot have sex. Does it make sense? It doesn't make sense, right? If you want to talk about natural birth, got wound down there lah, maybe lah. But now Caesar up there not down there Why after Caesar, then only she have pain? And why only after Caesar, then only she cannot have sex? So you see. So this is when the pain started. So when your pain start from the very first day you have sex, then I will think about different things. But if your pain start only after something happened, or maybe nothing happened, all along no pain, but now only pain. So what are the causes of, let's say, if you only have pain after? Okay, things must have happened lah. So number one, give birth, hormonal changes. So you have vaginal dryness, that's why got pain. But as I say, once your period come back like normal, then your vaginal dryness no more already. If you still have pain, then there's other reason, okay? And then there's also menopause, because when you menopause, also hormonal changes. When hormonal changes, then the vagina dry. So vagina dry, then you have pain. So that one is due to menopause. Okay, the other group of people are people where we say is due to infection, because another reason for dryness is infection. Many of you have candida. Candida is a very common infection. I think I just simply throw a stone, I'll get one. So candida infection, it is quite bad, that affect the outlet, down there, all the outlet place. If you have candida infection there, then it's actually very dry and also very easy to hurt. Actually, when you have sex, when you have candida, very bad candida, you even see wound on your private part. If let's say, if I were to examine you, you say yesterday I have sex, very painful. If today you come and see, the day after you have sex, if you come and see, I can actually see abrasion wound, abrasion wound, superficial abrasion wound, because infection can also cause a lot of dryness, and also infection cause your skin to be very thin down, and then very easy to get hurt and injured, okay? So that is due to infection. Then, so those are the physical causes. Then after give birth, what else can happen? Sometimes if you have natural birth, let's say your stitches got problem. I have seen cases where after the natural birth, because the wound didn't heal properly, and now they actually create a band across the outlet. So now if this is your outlet and then you got a band across, so how are you going to have sex, right? So whenever the husband try to go in after giving birth, then it can be quite painful. So that one is physical causes. So other than physical causes, there can also be psychological causes. Like the examples I quote to you just now. When she didn't want to have baby, they were using condom, then they got no pain. Then when she wanted to have baby, then she started not using condom, then started pain. Actually, those are not due to the condom one. It's all due to up in here, because now you're trying to get baby. Maybe you are so stressed trying to get baby, that's number one. So when you're stressed, when you're having sex and you're stressed, sure, down there will be very dry, right? If you actually have sex, you need to be in the mood, when you're in the mood, then down there will be wet, isn't it? So if you're very stressed out having sex, of course down there will be drier, then of course it will be painful. Another group of people actually, although they want to get pregnant, but they're very scared. I'm very scared. Actually, very scared to get pregnant. I want to get pregnant, but I'm scared. So this crowd of people, also they will find sex very painful the moment they stop using contraception. So it's not due to the condom. It's all due to they all being scared. Okay. So this is psychological. So just now I talked about condom, contraception. I also talked about childbirth. The case that I quote to you, first baby, natural birth, no pain. Second baby, Caesar, only pain. Why? That was birth trauma. Actually, birth trauma, I've seen many women with birth trauma. After giving birth, very painful sex one. They have difficulty trying to have sex. And I have some even totally just no more sex, no more baby, that's it. Okay, so that's why that was due to birth trauma. So birth trauma, don't live in silence, okay? That's why I say this video you must share, because there are actually a lot of women who live inside, suffer in silence. They have birth trauma, they have painful sex, they don't know where to go, they don't know who to ask. So please share your video. I am very sure each and every one of you have a friend on Facebook with painful sex, okay? So please share this video, alright? So, okay, so the second thing I told about is birth trauma. So when they have birth trauma, after they give birth, they're actually very scared to have sex one, because sex is related to pregnancy, pregnancy is related to trauma, this thing is related. So they are very scared to have sex. So even if they have sex, they are not into it, their mind is not into it, their mood is not into it. Sure dry, sure painful, okay? And not only that, when they have fear, actually sometimes the muscle will contract so tightly that when husband go in, must use force to go in. Sure painful lah, sure injured lah, okay? So please share this video, that's the most important thing. So this is psychological causes. So you can have physical causes and psychological causes. So now I've already explained the causes of painful sex for people who last time no pain, now only pain. So something changed. But most of the time, all the pain that I'm talking about is superficial pain. Because just now I mentioned there's two types of pain. One is superficial pain, one is deep pain. Superficial pain means upon entry you feel the pain down there at your vagina, okay? Deep pain means you pain at the tummy. Every time you have sex, you have this pain at your tummy, okay? So that one is superficial and deep. Most of the time for psychological pain is usually superficial pain, because it's usually due to dryness. It is also usually due to if fear, then they contract so hard the muscles, so that's why it's very painful. And then for infection pain, pain due to infection, pain due to hormonal changes is also superficial pain. Okay, then now we talk about people who have pain from the very first day they got married. People who have pain from the very first day they try to have sex, and they have been having that pain all their life. So this group of people, then I have to find out whether they can bear with the pain or they cannot bear with the pain, okay? So let's talk about those people who have pain right from the beginning of the first time they have sex. There can be also many reasons. They can still have reasons that I mentioned earlier. Okay, let's say they are nearing menopause. Okay, we won't know, right? Some people, maybe they are single all their life, but only at the age of 45 or 50 they found a life partner. So then only they started having sex. So but they're already 50, their hormonal changes already not so they are not so lubricated at that time. They're drier, so they have pain. So that's one. Another possible causes, infection, of course, because just now I mentioned candida, right? Almost so many women got candida. I already said I throw a stone also, I most likely will get someone with candida. So if they have candida infection all their life, so when they started having sex, they were already having the candida infection. Of course, it will be painful also lah, okay? But the other thing I want to talk about is physical causes, about the band. Just now I talked about the hole with a band, right? If you have a hole and have a band inside, so then you cannot have sex. So painful when the husband tries to go, it's so painful because there's a band. So this band can be inborn one, you know. You can be born with a band. Not necessarily it must form after giving birth. You can be formed with a band. So people who are formed with a band, they are like that all their life, but they didn't know, right? Because they never had sex before, so they don't know. So now you have sex and then it started causing pain. So then only we will want to see whether there's actually a band. So band is very easy. Have a band, just cut the band now. Just cut the band. Okay, and solve all the problem. Okay, so that will be physical causes. Other than physical causes, then actually very big component. In fact, I would say 90% of all women who have painful sex from the very beginning of their sexual life is usually due to psychological causes. Psychological causes, there are certain stress. Let's say you are not married, okay? You're not married, and you are trying to you had sex, but you're so scared, right? You're not married, ma. You're scared. If I had sex, is it, you know, some people very religious, they will find it sinful. Some people very scared, what if I get pregnant, I'm not even married, how am I going to tell my mommy? You know, or some people, the mother, all their life tell them, hey, you cannot have sex before you get married, it's very bad, very bad, very bad. So they know, their mommy is going to be very angry if they have sex before they got married. So sometimes some people are very stressed when they have sex. They will find it painful. And what's the problem when you start having pain when the very beginning when you have sex is that this pain, you believe in it already, it's all in your mind already. So you go into a vicious cycle. So when you have sex, you feel pain. The next time you're going to have sex, you already scared. you scared to have sex because you scared to be painful. So when you scared to have sex because you scared it's going to be painful, then number one, you are not into the mood lor. So your private part will be dry. Number two, you're going to hold it so tight, so it's going to be very painful. So your mood is also very important, and your fear. We do not want you to fear sex lah. Okay, people fear for many reasons. I have people who fear of bleeding. Fear for many reasons because they hear a lot of horror story. They hear about hymen tear lah, bleeding lah, injury lah, and then sometimes Google tell all kinds of things. So when they start to have more fear, that is when they will actually what will happen, they will have a lot of fear trying to have whenever they have sex. And once they have sex and they have pain, they go into a vicious cycle. They always think that sex is painful, that's why they cannot get out of it. Okay, so that is those people who have painful sex from the very beginning, from the very first time they try to have sex. So this is one aspect that I will always ask. So next aspect that I will ask is whether the pain cause you to can still have sex or cannot have sex. Because when you can have sex and cannot have sex, that is also something I need to know. Because when you cannot have sex at all, there is somebody that you know, I definitely need to do something, and I know that it's not going to be easy. So those people who cannot have sex at all, they can be either due to number one, it has a ban there, or it's a ban, how to have sex, right? Something there like no entry sign like that. So these people definitely need to cut off the ban now. But there are another people that nothing, everything is perfectly well, but they just cannot have sex. I've seen so many women like this. We call it vaginismus. Vaginismus people, I've seen so many. So many. Okay, they can be married 5 years, 10 years, 20 years, they never had sex before because they just can't do it. So these people, majority, more than 90% is still a psychological problem. And we have to deal with the psychological problem before we can help them. So this group of vaginismus, what will we usually do? I will tell you the entire program that we have in our clinic. It is a combined effort of 3 persons. We have 3 persons in the clinic managing the same lady. 3 persons. Number one is me. Okay, what do I need to do? Number one, I need to examine whether there's a ban. If I know there's no ban, then I will have to sign her up for this program. In my clinic, I have this program where a team is managing it. What do the team do other than me? I usually see the beginning and the last. In the middle, I leave it to them. So number 2 is my physiotherapist. What does my physiotherapist do? Number 1, she will teach you anatomy. Women need to know anatomy of her own body. Okay, they need to learn their body. They need to know where is the vagina, where is the every parts of the body down there. So we will teach them. We show them a mirror. We show them everything. We have to teach them. Number 2, we teach them Kegel exercise. So we teach them to learn to control their muscle, how to squeeze, how to relax, how to squeeze, how to relax. Because very often it is fear that makes them squeeze. So they know how to squeeze, but they don't know how to relax. So we have to teach. So the physiotherapist actually teach them to do all these exercises. And then third, we start to use dilator. We just start dilator. We start with very tiny one. We start with a 5mm. Normally I start 5 or 6mm dilator. We insert the dilator into the vagina. We build up their confidence, and then we make them do it themselves. Then they got homework. They bring back a dilator, and then they have to do homework at home. Practice on the dilator, and then come back, and then we keep increasing the size. We can increase up to 26mm, which is very good already. And then after dilator, then we will start to teach them also. My physiotherapist usually will teach them how to insert their own finger. We want women to explore themselves, build their confidence to insert things into their vagina. And then after that, we also teach them on sex. That one, usually I will also teach them, or my physiotherapist will teach them. We have to teach them how to learn to enjoy sex, the pleasure of sex, the aim to achieve orgasm, because they need to enjoy sex before they can actually let go of their fear. And then when they achieve orgasm, then I have no problem about down there being dry. And then we teach them various sex positions, because there are certain sex positions that's more painful, certain sex positions that's less painful. So all this we teach in our Vaginismus program. And then on top of that, there's the second person. The third person that will see that the lady will have to see is my therapist. I think if you watch almost all my videos, I always talk about my therapist. So I have a therapist my therapists deal with women problems. So one of the problems they need to deal with is vaginismus. So they see my therapist. My therapist will go and explore their fear. What are the fear? Why they scared? Why they scared to have sex? Some women, they know why they're scared. Some women, they got no idea why they're scared. So that is why you have a therapist, okay? Some simple example why a woman fears sex. Number one, maybe when they are a child, they fell down. They fell down, they injured their private part, and then go and see doctor, got bleeding, and then stitch up. A lot of these things is a childhood trauma. It's a childhood trauma, so they never thought that that incident caused them to have fear. So that is one example. But there are actually many examples. Some people is traumatized by a lot of rapes and not necessarily they themselves. Some women is themselves. They are probably a victim of molest, victim of rape, victim of incest. But some is not. Some is they like to read. They like to read this type of story. Some people just love to read this type of stories whenever there's newspaper story about rape lah, incest lah, molest lah, they like to read, and some of them even go up to the extreme of reading those extreme cases. So they always got this fear. Some is due to that, but it can be due to anything one. I have seen people like just now I told you, birth trauma. I have also seen people who just scared of seeing blood. They scared to any injury they see on their body also they scared one. So if sex is related to having bleeding, then of course they scared lor. There's some people who just get any pain in their life, you just poke them also, they scared. All sorts of pain they scared. So of course they also scared lor. They will always hear people say sex painful, or when the first time they do it, not really well prepared to do it. So they find the first time having sex is really painful, then they already scared lor. So every woman have a different reason of fear, and that is why we need a therapist, because we need a therapist to help you to reduce your fear. So earlier your fear may be 10 out of 10. So after see therapist, every time you see it will come down one. It's like all my ladies who see my therapist, they always say, I'm so surprised I can do that. I'm so surprised today the doctor asked me to do this, I can do. Or the physiotherapist asked me to put the dilator, I can do. I can never imagine. Or I'm so surprised I can put in my finger. I have all along tried, but I'm not there to put in. So why? Because we reduce their stress level. With each session they see my therapist, their fear come down from 100% to 80% to 60% to 40%. So we do together, the physiotherapist and the psychology therapist. We go together. So we reduce and then we increase. So you see, we reduce the fear, then we increase the dilator size and the things they have to do. Then we reduce the fear, we increase the things they have to do. We reduce the fear, we increase the things they have to do, and then at the end we reach to the final ultimate aim is to actually finally successfully have sex with the husband, and of course we hope that they get pregnant. Okay, so this is what I do with my Vaginismus women, and we actually have a program. They only need to come and see us 4 times. So the first time they see me and they see the other 2, they see 3 people, and then every time they only see my physio and my physiotherapist and my counselor, physiotherapist and my counselor. So after 4 times, if they still do not have sex, then they will see me. So I'm always the 5th person. The 5th visit only I'll see them again, and then I will see what else I can do. But very rarely they need to reach to the 5th session. Most of them will be able to have sex before the 4th section. In fact, some of them even have sex before the 4th section. By 2nd or 3rd also can settle some of them. Okay, so this is for vaginismus. Then the last question I said the other 2 more things I need to ask is whether it's superficial or deep. So earlier on I described mostly are superficial. They are all superficial one. Deep are only one. That deep, then we have to think about endometriosis. So if you have pain during sex is in your tummy, the first thing that comes to my mind is endometriosis. Number 2 is pelvic infection of the uterus, cervix and tube. Cervix, uterus, tube and ovary. So when you have infection of your pelvic organ, it can be also very painful when you have sex, but the pain is inside. So how to tell the difference whether it's endometriosis or pelvic infection? Pelvic infection means all along you got no pain, and then now suddenly you got pain, and then you have a lot of discharge also, and then when you take antibiotic, after that no more pain. So this is pelvic infection. Endometriosis is something that progresses with time, so it doesn't turn around, it doesn't get better. The pain only gets worse with time and not better. So maybe last time you got no pain, and now you start to have pain, and the pain is inside your tummy, they always think endometriosis. Because endometriosis is mild, it doesn't cause pain, but it's very severe, it causes pain. And you will see that the pain actually progresses with time. It doesn't go away unless you get it treated, okay? So I have covered all the things I want to say about painful sex. Again, I want to remind all of you, okay, please, please share this video, because women having painful sex is a real thing. It's a real thing. And then a lot of women don't know where to go, don't know who to ask, very shy, don't know what to say, don't know who to tell. And not all I think majority of husbands are very understanding. So far I've seen majority of husbands are very understanding, but I still see about a small number of husbands are not very understanding. They may think about divorce and things like that, because these women suffer in silence. So you need to help them. You need to share this video to as many people as possible, so then only you can help them. I am very sure every one of you have a friend in your Facebook that is having painful sex and is suffering in silence, okay? So share with everyone. Any one of you got any question, you can post up. Okay, normally this topic not many people ask also because everybody is shy. Okay, you can always make an appointment to see me if you are really shy to ask any questions on Facebook. To make an appointment to see me, you need to dial 012 322 9820. WhatsApp to 012 322 9820. So that is my phone number for appointment. You can make appointment to see me in my clinic. You can also make the appointment to see me live online consultation. But of course, if it's really vaginismus that need my whole team to help you, you really need to come lah. It's very hard to teach you how to do dilator, teach you how to put in your finger, all by online. So you definitely need to come. Remember, 4 visits, okay? Okay, may I know how about pain after sex? So again, the question is the same. If you want to know pain after sex, then I want to know whether the pain is superficial or deep. If your pain is outside, then it is most likely is due to some form of injury. Okay, you can actually have certain injury one. That's why I say some of you who come and see me the day after sex, then I can actually see outside a lot of actually like abrasion mark. Abrasion mark is like when you run and you fall on the floor, and then you see some superficial wound on your kneecap. So that is abrasion wound. So it's just very superficial. Of course, you get well over time. So if it's superficial, then it is some form of injury. That's why you have the pain after sex. So this injury can be due to, usually due to tightness, or maybe you squeeze too tight, or it can also be due to your skin got infection. The skin got infection very thin, so easily injured. So these are usually the 2 common causes usually due to infection or due to over tightness until you got injury. Dry, can you imagine if it's dry and then tight and then somebody rubbing on this, so you have this superficial injury. That's why you have pain after sex, okay? But of course, you also need to ask yourself, is your pain after sex urination pain? Because if it's urination pain, you can still have urine tract infection. But urine tract infection, you only have pain after during urination. So if it's injury, you also know because after you have sex, let's say you go to the bathroom and clean yourself, actually when you touch the area, it's very sore. This is due to injury. So injury is usually either due to dryness or due to infection. If you want to make appointment, remember you can WhatsApp, WhatsApp, don't call, WhatsApp to 012 322 9820, okay? So please share this video, because a lot of people suffer in silence and they do not know where to go, and some of them can be also at the verge of divorce and you do not know about it. So if you want to help your friend, please share this video to as many people as possible.